For everyone in lockdown in Victoria, there's some more promising news this morning with another relatively low number of new cases detected in the past 24 hours. But that death toll continues to rise. Here's reporter Elias Kluwer in Melbourne.
There's 51 new cases recorded in Victoria. That's down from 76 the previous day and 55 the day before. Now, with that 76 figure yesterday, the state's authorities attributed it partly to the fact that there was double the amount of tests in 16,000. So it'll be interesting to see how many tests were conducted in the past 24 hours that it's delivered that 51 number. Now, as you mentioned, 7 more deaths, taking the state's death toll past 701 tragically, but all eyes will be on the average, which is of course the determination of when Melbourne will be moved to the next step, and of course regional Victoria. So yesterday active cases dropped by 74, but of course it's all down to the cumulative cases divided by 14, and currently that number in Melbourne is about 75, and it will probably drop again today. But in regional Victoria, that number is about 5, and it's prompted the Premier Daniel Andrews to suggest that regional Victoria could skip to step 2, which will see hospitality venues open, and there be no, reason or other reason for you to leave your home. No restrictions as to why you can leave your home. So it'll also see schools open as well. There's only 82 active cases in regional Victoria, and there's hardly any cases in Bendigo and Ballarat, 2 big regional centres, and just 15 in Geelong. So people and mayors across regional Victoria are cautiously optimistic that they could see restrictions eased quite soon.
And Elias, what's the latest information on how this has been affecting the economy?
Well, the City of Melbourne commissioned PricewaterhouseCoopers to provide, modelling of the economic impacts of COVID-19 lockdowns. Now, the auditors have reported back that over 5 years, or modelled into the future of 5 years, the Melbourne economy could contract by $110 billion and contract by 22% in 1 year alone. Lord Mayor Sally Capp has said that 22,000 jobs are likely to be lost over the next year in just the hospitality and accommodation industries alone. She's said that Melbourne was a booming city prior to all of this and has called on urgent federal and state government financial support.
And Elias, people in Victoria will be very familiar with the conditions of this lockdown that you've been experiencing there for the last several weeks now, but people outside Victoria won't be particularly familiar with them. But as part of this lockdown for you guys there's been this curfew. Explain for us what that has been and what the discussion is around that now.
Well, the curfew was introduced over a month ago, and it starts at 8 p.m. at night and goes till 5 a.m. in the morning. So unless you have a valid reason to be outside at that time, you'll be given a fine by Victoria Police. And I can say from experience, having left work sometimes after that time, police are monitoring and roaming the streets looking for people that are out that shouldn't be. Now, epidemiologists question the effectiveness of this curfew, and on Tuesday the Chief Health Officer revealed that it wasn't his idea. Now, yesterday the Premier Daniel Andrews said at his daily media briefing that the Chief Health Officer provides the advice and it's up to him, the Premier, to deliver the outcomes. So in consultation with Victoria Police, it was determined that a curfew should be brought in. However, the Federal Health Minister, Greg Hunt, has said he's surprised that this wasn't specific health advice delivered by the state's health authorities, and he's actually called on Daniel Andrews to lift that curfew. So has the state opposition leader, who's described it as a Daniel Andrews captain's call.
Now, health officials in New South Wales are concerned about a growing COVID-19 cluster after more people have become infected at Concord Hospital. Reporter Alexia Atwood has more from Sydney.
New South Wales, 9 new cases, 5 are linked to this growing cluster at Concord Hospital. That's because 2 more healthcare workers have tested positive. plus a patient, plus 2 household contacts of that patient. And that means that this cluster at Concord and Liverpool Hospital has grown to 12. We are grouping this cluster together, but we don't actually know how it started yet. We still don't know the source of it, but authorities are contact tracing and they are trying to figure that out quickly, but they do fear there could still be more cases to come of it. So as a precaution, what they've done is they've cancelled elective surgeries at Concord Hospital. They've said no visitors here, and there are about 100 staff isolating across Liverpool and Concord Hospital. Now, just keeping you up to date of the other cases in New South Wales from the last reporting period, we had 1 mystery case from southeastern Sydney. We've also had 1 from hotel quarantine, and 2 are connected to that growing CBD cluster as well.
And Alexia, people in New South Wales have been able to go out for a bite to eat at most places, but there are restrictions. But what's been happening at the Opera House through this period, and what's happening there today?
Well, Joe, essentially the Opera House is opening up its dining venues to the public. They've been closed since the pandemic began in Australia in March. And obviously the Opera House, it's so intrinsically linked to Australian identity, and that's especially the case for Sydney-siders. So it's rather symbolic of the fact that we are really moving into this new normal. Even though we don't have the tourists here, at least these venues are open to locals. And the CEO of the Opera House, Louise Heron, she says that opening up the dining venues, it's the first of a staged approach to opening up other events and experiences at the Opera House. And she says, of course, they will be managed in a COVID-safe way.
Alexia Atwood reporting there from Sydney. Let's turn to Queensland now, and no new cases in the Sunshine State in the past 24 hours of coronavirus. And there have been more than 1 million tests processed in Queensland now. The total number of active COVID-19 cases in the state is now 27. Premier Anastasia Palaszczuk has told State Parliament more than 10,000 tests were carried out in Queensland in the past 24 hours, and more than 1 million since the pandemic began.